Her brain was pulling away from the inside of her skull. The CT showed it. Dark gaps widening where brain should have been pressing against bone. Fluid rushing into the space left behind. 2 hours earlier, she drank a bottle of soy sauce on a $50 dare.
She was 21, senior year, pre-med at a state university in Virginia. 3.8 GPA, 26 days from graduation. It was a Saturday night, and the finals. Someone brought a bottle of soy sauce to the party as a joke. The dare started small. A sip, then a shot glass. Then someone bet her $50 she couldn't finish the bottle. 1 liter. It doesn't sound dangerous. It's soy sauce. It's in every kitchen in America. But 1 liter of soy sauce contains roughly 160 grams of sodium chloride. For a 60-kilogram woman, the lethal dose of salt begins at 45 grams. She consumed more than 3 times that in under 4 minutes.
The first symptom came within 15 minutes. Thirst. Extreme, unquenchable thirst. She drank 3 glasses of water, then 4, then 5. Her body was screaming for dilution and nothing was enough. Then the headache hit, a deep, pounding pressure behind both eyes, unlike anything she had felt before. She told her friend she needed to lie down. By midnight, she was confused. She couldn't remember her roommate's name. She kept repeating the same sentence over and over. Her friends thought she was drunk. At 12:15 a.m., her body went rigid. Her eyes rolled back. Her jaw clenched shut. She began to seize. That is when someone finally called 911. Paramedics arrived in 7 minutes. They found her on the apartment floor, unresponsive, arms locked at her sides, teeth grinding. She was not responding to voice. She was not responding to pain. Glasgow Coma Scale 3, the lowest possible score, a score that means the brain has essentially gone offline. They started an IV, lactated ringer solution at 200 milliliters per hour. They rushed her to the university hospital. In the ambulance, she seized again. She arrived at the emergency department at 12:38 a.m. The attending physician ordered a full metabolic panel. The results came back in 11 minutes. Serum sodium, 191 milliequivalents per liter. Normal is 135 to 145. Anything above 160 is life-threatening. She was at 191. Her doctor had never seen a sodium level this high in a living patient. At this concentration, water is being ripped out of every cell in the body, including the brain. He ordered an emergency CT of her head. The images loaded on the screen, and the room went quiet. Her brain had visibly pulled away from the inside of her skull, dark gaps where cerebrospinal fluid had rushed in to fill the void left behind by a shrinking brain. This is what happens when sodium in the blood skyrockets. Water follows salt. It is the most basic law of physiology, osmosis. Where sodium goes, water follows. When there is far more sodium outside the cells than inside, water floods out of the cells to equalize the concentration. The cell brains lose water. They dehydrate. They collapse. And when the brain shrinks, it pulls away from the inner surface of the skull. The tiny veins that bridge the gap between brain and bone, called bridging veins, begin to stretch. If they stretch too far, they tear. And when they tear, the brain bleeds. She was on the edge of a hemorrhagic stroke. Her doctor faced a decision that no textbook gave a clear answer for. The standard treatment for hypernatremia is to lower sodium slowly, no faster than 10 to 12 milliequivalents per liter per day. The logic is simple. If you correct sodium too fast,
Water rushes back into the brain cells before they can adjust. The cells swell. The brain swells. Cerebral edema. That can kill you just as fast as the original problem. But there's one critical variable: timing. In hypernatremia, brain cells begin generating something called idiogenic osmoles, small organic molecules that accumulate inside the cell to hold onto water and prevent further shrinkage. This adaptation takes hours. Once those osmoles build up, rapid correction becomes dangerous. The cells are full of extra solute. Flood them with water and they swell beyond their normal size. But if you catch the patient before adaptation begins, within 2 to 3 hours of ingestion, aggressive correction may be the only thing that saves them. Her doctor looked at the clock. It had been 1 hour and 51 minutes since she drank the soy sauce. The window was closing, and every minute he waited made the treatment more dangerous. He made a call that no guideline fully supported. 6 liters of free water delivered through a nasal gastric tube over 30 minutes. To understand how aggressive that is, the standard fluid rate for severe dehydration is about 1 liter per hour. He was giving 6 times that. The nurses pushed the fluid. The team checked her sodium every 15 minutes. The numbers began to fall. 191, then 178, 165, 152. Within 3 hours of arrival, her sodium was back to 145, normal range. The next morning, she opened her eyes. She could speak. She could move her arms. She knew her name. She knew where she was. Her brain, which had been visibly shrinking away from her skull 12 hours earlier, had returned to normal volume. She was the only person in documented medical literature to survive a sodium level of 191 from an acute oral ingestion with no lasting neurological damage. What happened inside her brain that night comes down to one word: timing. Her doctor recognized that 2 hours was not enough time for idiogenic osmoles to accumulate. The brain cells hadn't adapted yet. Rapid correction would push water back into cells that were still ready to receive it. No risk of overshooting into edema. Had she arrived even a few hours later, the outcome might have been the opposite. A 40-year-old woman in Japan ingested a similar amount of soy sauce. She was treated 6 hours after ingestion. By that time, her brain cells had already adapted. They were saturated with organic osmoles. Her doctors corrected her sodium rapidly. Water flooded into the adapted cells. Her brain swelled. She died on day 8. Same poison, same treatment, different timing. One lived, one died. She spent 3 days in the ICU. An MRI showed temporary changes in her hippocampus from the seizures, but no permanent damage. 1 month later, she graduated on time. She never told her parents what happened. Her friends deleted the video. 1 liter, 4 minutes to drink it, and a window that was almost too small to save her. Right now, your sodium sits somewhere around 140. That is the number your brain needs to hold its shape. A single bottle of soy sauce can push it past 190 in under an hour. No one at that party knew that. No one at any party knows that. Dose makes the poison. Timing makes the treatment. And some lessons cost more than $50.